One of these things is not like the others. Which one is different? Do you know? Can you tell which thing is not like the others? I'll tell you if it is so. Well,
food, water, energy, and healthcare are all things we need to live long, healthy lives. Many of these goods, such as food and energy, are commoditized, meaning that they are widely available from many sellers in a competitive marketplace. If the prices are too high, you can just buy from someone else. This dynamic keeps prices in check. Here are the prices of several popular drugs in different countries around the world. Vytorin and Lipitor for high cholesterol. Nasonex for nasal allergies. Nexium for acid reflux. Note that each drug in this broad selection is considerably more expensive in the U.S. than in any other country.
The United States spends more on healthcare than any other country in the world, at over $8,000 per capita annually. To put this in perspective, healthcare, not defense, is the top expenditure of the United States federal government, at almost 1/4 of the budget. And this despite many citizens not even having government health insurance. Is this because the raw materials are expensive? Is it because the manufacturing process is expensive? Is it because research and development costs for new drugs are so high? Or is it something else entirely?
You start out maybe with thousands, tens of thousands of compounds. You weed down through various steps that cause many of these to fail. Ultimately, maybe you can run a clinical trial with 4 or 5 of these, and if all goes well, 14 years after you started, you will get one approval. And it will cost you upwards of $1 billion for that one success.
A recent paper by Donald Light at the University of Medicine and Dentistry of New Jersey and Rebecca Warburton at the University of Victoria, titled Demythologizing the High Costs of Pharmaceutical Research, indicates just the opposite. According to the authors, the $1 billion R&D cost per new drug that Big Pharma frequently quotes was taken from a study heavily influenced by the industry itself, and that the real figure is closer to $55 million per new drug, a decrease of 95%. Further, this would not explain the wide price discrepancies that we see between the United States and other countries because R&D is not a unique necessity of the United States. So, what does explain this discrepancy? One component of this expense that overwhelms R&D spending in the United States is advertising. This image depicts a study conducted by the Ritholtz blog that compiles research from sources such as the United States Department of Justice and CNN that indicates Big Pharma spends roughly twice as much on marketing than on research and development. Are these high prices an ethical or moral concern? Does a pharmaceutical company have a duty to support public health? If so, is the imperative of maximizing profit at odds with this duty? The pharmaceutical industry has a huge stake in the answers to these questions, voicing its opinions strongly with the greatest lobbying expenditures in the United States Congress by far, nearly twice that of the oil and gas industry. But we the public have a stake in the answers to these questions as well. Health is a basic necessity that is becoming increasingly out of reach of many Americans. Where is your voice? Start a conversation, and let's work together to make the pharmaceutical industry work better for the health of all.